Hi everybody, it's Claire Fitzpatrick, your friendly neighborhood chiropractor, and I'm doing a follow-up video for knee pain. The last video had little tips that you could do for self-massage to try to loosen up things around the knee so that your knees can feel a little bit better. And I'm going to show you some things that you can do to strengthen and balance the musculature and the tendons in the area. They're not perfect. They don't substitute for going to a chiropractor and getting your spine checked to make sure that your nervous system is firing evenly, your concentric and eccentric balance. So I want you to do that when you can. I'm going back to work on June 15th, so I'm really looking forward to that. So I'm going to show you a few things you can do if you can't go see your chiropractor anytime soon to help that are safe. And if they hurt at all, then there's something else going on that you really need to get checked anyway. So one of them is what I like to call a Kegel for the legs. Do you know what a Kegel is? This is something I give my patients anyway, and I should show you in another video. It's a pelvic bowl strengthening, and how you go about it is that you clench your pelvic bowl like you have to go to the bathroom. Both bathroom, all bathroom. If you're a woman, you're clenching your vagina. Clench, release, clench, release. Obstetricians give that exercise, and midwives give that exercises to pregnant women so that they can tighten things up after the birth pretty easily. So keep things nice and strong. But it also is good for strengthening the small muscles of the postural muscles of the low back. So another time for that. This is about the knee. There's something similar you can do for the knee. So let me show you. So straighten out your knee, both of them, but start with one. Clench the whole foot and release. All the way from the hip to the toes. Clench, release, clench, release, clench, release, clench, release. So you're tightening up all the muscles in your upper leg and your lower leg, and that's tightening up the musculature and the connections at the knee. And do the same with the other side. Clench, release, clench, release, clench, release, clench, release. 3 sets of 10 ought to do it. Give yourself a day in between, especially if your knees are really, really sore that way. So here's something else that you can do, and it is a modified squat. Be careful with these. So how to check that there's probably misfiring of your pelvic musculature is to do a squat and see if your knees start to buckle on the way down, a controlled squat. So I actually have this issue, or I have been. So I'm going to try and shoot it from the side. Get out of there. Nasty looking brown shirt. Okay. So I'm going to do a squat and check my knees to see if they wobble. I don't know if you can see that, but my left knee wobbles more than my right. I'll show you from the front. So my toes are forward. They're not out like that. They're not in. Check your toes. Control from the hips. And do a squat. I'm looking at my knees. Now it's behaving itself, but more on this knee. I don't know if you can tell, it's sort of doing this. That means I have an imbalance on this side and I need to get adjusted. My atlas is doing something wonky with my cerebellum and my position sense is off. But for your purposes, this is something that you can do to check that you may have something going on that way. So a strengthening exercise you can do. Hold on to something, lift your leg and go down and up and down and up. Don't go too far down. And if this hurts too much, then stop it. Do 8 to 12 just like this. I'll do it this side too so you can see. Up and down, up and down, up and down, like that. And then you could do just what I was showing you before, two-legged. As far down as you can go comfortably. Don't force anything. You're in rehab. This is not for strengthening and making yourself a monster. This is for getting it better. Movement is life. Breath is life. Must move. All right, so those are two simple things that you can do. I don't want to give you more than that because it could be exacerbating a problem rather than helping it. So that second one, you got to check. Make sure that you're okay with that. And if you're not okay with it, stop it and go get to your chiropractor and find out what's going on with your pelvis and your upper cervical spine. That's it. All right, have a good day. I'll talk to you later. Bye.